Good morning, everybody, and welcome back to your Lunch Break Live. My name's Ivana if you're new here. If you are not, thank you for coming back. Today is, I don't know what today is. Today is Wednesday, June the 30th. We are almost finished with June, almost into July. It's kind of crazy to say that. I feel like we were just talking about January, but here we are. And I am joined by a familiar face, our own Leada Gore here at AL.com. And today we're going to talk about vaccination rates. Now, I know there are many events that are back this year for July 4th for the long weekend coming up. A lot of these events did not happen last year. And I know a lot of people are ready to get back out there, get involved with their community, and do some of these fun things. But again, we know that there are still some cases of coronavirus going around here in Alabama. We know our vaccination rate is not great. So Leada's going to help us break down the county by county vaccination rates. And we're going to talk about some counties in Alabama that have risen up in their risk levels. So Leada, thanks for joining me. We're going to pull up the map here in a minute, that interactive map from the State Department of Health that we have really depended on here for a year and a half now. But before we do that, let me ask you, what are we looking at statewide of vaccination rate?
Well, where we are now, excuse me, I've got two things going at once. I'm scrolling, looking at numbers because I have to look at them. We have about 37% of our population vaccinated. Now, that is according to the Alabama Health Department, and they about 2 months ago slowed down the rate that they were reporting their data. It used to be daily. Now I think it's Tuesday, Thursday, and Friday. Or Tuesday, Thursday, Monday, some schedule. And so we do see a little bit of a lag, because I noticed there's like several other websites that track, like credible websites that track vaccinations, that are showing us a little bit higher. But since we've always used the health department data, I felt consistent using the health department data. So we're about 37%. That is the second lowest rate in the country. We are ahead of only Mississippi, and they are pretty far behind. They're about 30%.
Now, I just looked at this dose this morning. And again, if you are looking, we're going to put a link here to Leada's story from yesterday. So if this number varies slightly, that is why. But as of the reporting this morning on the State Department of Health website, there have been 3,232,660 vaccine doses administered. Now, that means that 748, people have completely completed their vaccine series. What that means is people who got a 2-shot dose, they've already gotten both of those doses. If you just got the one Johnson & Johnson shot, then that includes that as well. So again, just a little bit over 1.5 million there. Leada, the interesting thing about the Department of Health is when you just look at this main dashboard, I'm going to pull it up here so people can see it. There's not a percentage number of the population that is easily available. So that means you kind of got to do the math, which I know is not something that we enjoy doing. But I know that you said we are about 37%. We're pretty low, again, over just over Mississippi's vaccination rate. They are lagging behind at about 30%. But Leada, that's for the state. So are there any counties in the state that are doing better than the state as a whole? So doing better than that 37%?
Yes, there are, rough math, I would say 15, 20. And one thing to remember, I think one of the reasons people are hesitant on the percentage, reporting the percentage, is because you do have some people who get 2 doses. You do have some people who get 1 dose. So what they're doing is they're counting it based on the first dosage, because there's a difference in the doses. So they're assuming if you got the first dose, you're going to get the second. So that's where you run into some of the reporting questions. It's very interesting to see the counties that have that higher level, because we've heard about access in rural healthcare areas that are underserved, that perhaps there was a delay. But our Lowndes County is... Now, this was as of the other day. And again, you're going to see some numbers, because I've seen Madison County reported as the highest, being the first county to be over 50%. But the health department has not reported that yet. So when they do, we'll report that. But Lowndes, Jefferson, Shelby, Bullock, Madison, Perry, Marengo, Wilcox, Hale, Greene, Macon, Colbert, those are all above 37%.
Well, and you look at this map here, and I was trying to make it bigger. It's kind of hard to enlarge it. So if you have a question about your specific county, please drop it here in the comments. I'm watching them come in and we can talk about that county's numbers. But without having to click on every county in the state, all 67, if you just do a quick glance at this map, you can kind of tell, and excuse the background noise, my cat's having a ball. You can kind of tell how a county is doing based on its color. And when I say the color, I mean the darker the blue on this map, the higher the vaccination rate per capita in that county. Is that correct, Leada?
Correct.
Okay.
And so what you're seeing is that Black Belt of Alabama, which is a very underserved area as far as healthcare, is actually doing pretty well in some cases. And a lot of that is because the health department has put a big emphasis on mobile vaccination clinics and taking the vaccine to the population, as opposed to, say, in Jefferson County, where they wanted, you go to your doctor, you go to Publix, you go to CVS, you go wherever you go. They've done a good job of really, reaching out into the community to provide the vaccines.
Mm-hmm.
And one thing that can be a little bit off on some of this, there's some questions about if you're receiving that dose on a military base, which kind of makes me question some of would it be southeast part of Alabama. They were not reporting COVID numbers. Department of Defense facilities quit reporting COVID numbers early on because it became a risk for security risk. So I don't know if they are reporting vaccine numbers. I know the Department of Defense has put a big emphasis on vaccine numbers. So I kind of wonder, some of those southeast counties, if we're down there by Fort Rucker, if we're running into some of that, there may just be a difference in data, but they have had a case increase. And we have seen that because what's interesting is some of our vaccination rates, like Russell County is 19%. Cleburne's 22, Escambia is 25, DeKalb is 26. So they're, less than 1 in 4 basically is vaccinated.
Right. Well, and as we wait on people to, ask about their counties, let me quickly talk about this. And this is something you reported the other day as well, Leada. And we made this graphic here to kind of make it a little bit easier just to visually get that information. And that is that some of our counties in Alabama, and many people say this is linked to vaccination rates per county, some of our counties are ticking up a little bit in their cases. Those uptick in cases has led to a rise in their risk level, which is something the Department of Health has kind of deemed per county. Now, we made, again, this map, and Leada, I'll let you kind of explain the data there. But if you just look at this map, you can kind of tell by the color the counties that have been moved up in their risk category. Now, the counties that are in white are still low risk. So pretty much as a blanket rule, all the counties in Alabama are low risk, except these counties. So Leada, tell us about these counties and why they were moved up in the risk category, and if there is any reason why these specific counties, because just looking at it, several are kind of together, but there's several that are just very scattershot.
Yeah, and this is one thing that's super important to remember when we talk about this. There was a time when every single county was considered high risk. The health department used red back then, and it was red across the board. So we had 67 counties that were red. So we were talking hospitalizations reaching into the 3,500s. We now have hospitalizations lower than 200. So when we say very high risk, what that means is there is an uptick in both cases, your testing percentage, those indicators. Now, when you go from 0 to 1, that's a big increase. So we are not seeing the level of increase, of course, that we saw last winter into January. We're not seeing that. But what they are saying is these areas have noticed an uptick. Now, one thing the health department said is in the past, and we've talked about this before, I could almost, especially in the early days when the cases were more isolated, I could look at a county that had an issue and point to a reason. It was a nursing home. It was a VA facility. It was and then we had such wide community spread you couldn't. The health department is saying this is not a case of like outbreaks in certain facilities. It's just kind of a low level community spread. And they really want to emphasize that people still have to be vigilant. And if they want to get the vaccine, now is a good time to do that. Especially as we, move into concerns over the Delta variant, which is in Alabama. And I understand it gets very confusing for people. I do. It drives me nuts too, because one day you're told do this and next day you may be told to do that. So I think the health department's really just trying to encourage people to talk to their physicians and talk, don't depend on the internet to tell you what to do. And unless of course it's my story, and then you should depend on my story. But, to talk to their physicians and really encourage them to get accurate information about getting vaccinated. And then hopefully our numbers will increase, because we have some states that are, closing in on the 70%. I think it's Maine and some of our New England states that are really closing in on that 70%. And I think as we see that grow and those states, really start to bounce back even more than what Alabama has been able to do, I think that might encourage some people to go ahead and get vaccinated, to overcome that hesitancy. Hopefully it won't take another outbreak.
Mm-hmm. Right. Looking through some of the comments here, somebody did just make a comment too about midterm elections. I just want to quickly say midterm elections are not until next year. Those are 2022 elections.
Yes, thank you, Lord.
So just wanted to throw that one out there. So let's look at some counties. Now, I am in Jefferson County, so let's do that one. Let's do that one first here. So this is that interactive map from the Alabama Department of Public Health. And if you click on your county, it shows you your county's population. Then it shows you those percentages, so you don't have to do the math like Leada and I were just talking about a minute ago. So Jefferson, again, the most populated county in the state at about 658,000 population. They have got people who have completed their vaccine series. Again, that means if you got the 2-shot vaccine that you've gotten both of them, or you did that 1-shot Johnson & Johnson vaccine, that is 35.12%. Now, Leada, I know that we have probably a lot of people thinking that that's a little bit low for Jefferson County. I think people expected Jefferson County to be a little bit higher than just 35%.
Yeah, and that data may be a little old, because this is another thing that drives me bananas. The health department has different data on different pages, and sometimes that data matches and sometimes it doesn't, which I realize is maddening. Trust me, I understand. The table that they use for vaccination rates has Jefferson County at about 43%, but that's still very low compared to, the White House wanted 70% vaccinated by July 4th. That was obviously too aggressive. They're not meeting that goal. They're meeting it in certain age groups. And that's one of the really fascinating things I've looked at is your population 65 and above. I think the number was 80-something% are vaccinated. So obviously, if that's a more vulnerable population, that's great news, because you're not going to see the most vulnerable, not calling everyone 65 and older vulnerable, but you're not going to have that age-related issue as much. But Jefferson County, thankfully is blessed with some great healthcare facilities, and access to vaccines should not be an issue.
Right.
So we run into hesitancy, and that's the next thing to tackle.
Right. So I'm going to get out of that. And when you're, again, looking at the coloring on this map, we're looking at the 2 lightest counties. And one of those is Russell County. So looking at Russell County, they have just 16% of people who have completed their vaccine series. And that's, again, one of the lowest, along with, I believe, Cleburne County. And in Cleburne County, that's just a little bit higher of about 19.5% of people. So those are kind of our 2 lowest counties there. Now, you made an interesting comment to Leada about the highest counties, and several of those are in the Black Belt region. Now, you can look at that whole belt again that's in that lower third of the state, and which kind of extends down into Baldwin County for the vaccination rate here, and see a trend there. So, Leada, I didn't mean to interrupt you. Go ahead.
Oh no, no, go ahead.
There, I just was when you look at your county, it's interesting because there are so many different factors going into a county. When you look at statewide, you have the same thing, but it's interesting to me to see that it's not just South Alabama that's getting vaccinated. It's not just North Alabama. There are pockets across the state of high vaccination and low vaccination rates. Erica asked about Birmingham, Alabama. So Birmingham is a city within Jefferson County. So I can't give you the city stats. I can give you the county stats though, Erica. So in Jefferson County, we have out of about 658,000 people, we have about 231,000 people who are completely vaccinated. And those people, again, make up about 35.12%. Some tables from the Department of Health show it a little bit higher at about 40%. So hovering between that level. Now, Leada, I know you're in Madison County. So Madison County is doing about the same as Jefferson, it looks like.
Yeah, and I think a lot of that, Madison had scooted up just a little ahead of Jefferson in some figures. Let me pull that up. I think a lot of that is it's a different type of workforce. It's a federal workforce. Doesn't mean they're rushing out to get a vaccine. It's just a little bit of a different workforce. One thing I want to circle back to on our two lower counties, if you notice, obviously they're both on the state line, and Cleburne and Russell, and the question was brought up, especially is it, it's Russell. So, you're near Columbus? Well, no. Yeah, you're close. So if I cross the state line and I go get a vaccine over there, am I counted in my home county? And I don't have an answer for that yet. I actually am posing that question to the health department. It's a great question. So their number, are you a little higher? When we did testing and confirm cases, it would take a while, but everything would circle back to your home county. And I'm not sure if vaccine data does, but it's interesting to find out. I'm not sure how that's working, but we're going to find that answer out. But I think it's interesting that those two lowest counties are both on that border where there could be some potential for people to cross the state line to get a vaccine, if it's a little easier to get.
Well, and we know that especially when vaccines were just kind of hitting the states and getting into that availability, there were differences in eligibility in Georgia. So we did see a lot of people from Alabama that were just going over the state line to some of these clinics that sat in that Columbus area, that sat in Carrollton, in just those areas that aren't far from the Alabama border, because people were eligible over state lines to get that vaccine. So that's an interesting point there to note, Leada. Now, I know that you said Lowndes County was one of the most vaccinated. So we're going to look at quickly Lowndes County. And again, that's right next to Montgomery County, between Dallas and Montgomery County. And that has, according to this data, it's got about 36% of people who have completed.
That's probably a little low. They're about 47 right now. But again, when you have a smaller population, like in some of the Black Belt counties, if you have one big vaccination drive, you can flip the script pretty quickly. What's interesting to me is also you run into Lee County or Tuscaloosa County. You have a lot of kids home for summer. So college kids that are home for summer, so maybe they're getting that vaccine at home. Have they already got it at school? Are you counted at this address? Are you counted at that address? So, there's going to be some wiggle room, but overall as a trend, Alabama is not, knocking the doors down to go get their vaccine. And you can see the trend where it spiked up and then just went back down. And it's certainly not access in most places, because I can't go anywhere now, the grocery store, the drugstore, my doctor's office, my child's pediatrician's office, that they're not offering the vaccine. So it's just
that's a good point.
Yeah.
Good point, Leada. And
go ahead.
Go ahead.
No, I was just going to say the access issue seems to have solved itself.
Right. And if only we can solve now working from home audio delay issues, then we will be good. Different epidemic, I guess, for another time. So, Leada, I know that you've been reporting on this for us. Again, we're putting that link here in the comments. And if you need to see this map for yourselves that we were just showing, that is all available from the Alabama Department of Public Health. It's an interactive map. If you need help finding it, ask it in the comments and I'll jump in there and make sure you get there. Also, a couple questions about vaccines here in the comments. I think Leada and I both would say talk to your doctor, talk to your trusted physician to be able to get that most trusted information. Yep. Some people asking again where to find shots. I've got Felicia asking where she can find shots in a certain county. I will, Leada, if you have that answer, I will let you go ahead and answer that.
If you go to the Alabama Department of Public Health, you can literally Google Alabama Department of Public Health coronavirus, and it will take you to their pages. You can see a list of vaccine distributors. I would also encourage, if you have a drugstore, if you have a Walmart, which I believe is within 8 minutes of almost every single person in America, according to their statistics, those kinds of places. I realize you want to talk to your doctor, but so many doctors' offices, health departments, CVS, Walgreens, Publix, grocery stores, so many of those places are offering it. But probably the best place to start is either call your local health department or call your doctor.
And I'll leave that link that Leada was just mentioning as well, Felicia, here in a reply to your comment. Also, I do know in Marion County, the Cahaba Medical Care Clinic in downtown Marion County, I do know is also offering it as well. So, Leada, thank you so much for all of this information. Again, you can visit the Alabama Department of Public Health for that map. You can see leaders reporting here in the comments of our stories. And Leada, hopefully we don't have to have you back anytime soon to talk about these rates.
Talk about like ice cream and something fun. Something.
Yes. We unfortunately have you bring in bad news. Leada, thank you so much. Everybody watching, thank you. We'll see you tomorrow.